Good evening, everyone. Congratulations to all of our graduates. Please sit. We don't expect you to stand for several hours. Congratulations, and congratulations to your family and friends here to help you celebrate your achievements. You span many disciplines, from genetic counseling to biomedical sciences, clinical research and biostatistics, healthcare delivery, and public health. A common feature is that your training at Mount Sinai has provided you the ability to offer unique contributions to an increasingly complex and fragmented healthcare system that needs your expertise desperately. I'm in the basic biomedical research world. My laboratory studies drug addiction and depression in laboratory animals. We toil away year after year, adding our incremental findings, hoping for the big breakthrough that will influence clinical care. When I started my career almost 30 years ago now, I thought it might take 10 years to understand enough about the brain to come up with substantial clinical improvements in these illnesses. Alas, progress is slow. It's taking more than a lifetime. But in contrast, most of you are in fields and heading to jobs where your work can have real-world impact immediately. You are an impressive group, and your influence has already been felt, both globally and locally, during your time at Mount Sinai. Your work has included practice and research-based experiences, and many of you have focused on underserved populations and on critical issues in healthcare that demand creative solutions. I'd like to cite two examples from among today's Masters in Public Health, or MPH, graduates. One graduate spent her summer in North Dakota with people of the Spirit Lake Nation. This Native American tribe suffers from desperately poor economic conditions and considerable health disparities, with sky-high rates of preventable disease. Due to these conditions, tribe members are enthusiastic about entering health-related professions, but have had minimal opportunity or training. Mount Sinai partnered with a Native American community college, and our student helped to develop and deliver a health education curriculum aimed at promoting interest in health and healthcare professions among Native American youth. Besides teaching, the student also conducted a community health survey and had the opportunity to participate in community events. In Mount Sinai's own backyard of East Harlem, another master's student worked with Little Sisters of the Assumption, a neighborhood-based nonprofit organization that empowers members of a disadvantaged and vulnerable community to address the physical, emotional, educational, and spiritual dimensions of family health. Our student participated in the maternal outreach program, which includes prenatal and postpartum care to mothers and follow-up care to newborns, parenting and breastfeeding classes, and support groups to promote wellness and build nurturing relationships. In doing so, the student did her part to help reduce the disproportionately high rate of infant deaths in East Harlem. Although some of you will go on to further your education through PhD or MD programs, the large majority will take your master's degree and begin careers in health practice or administration, management consulting, research, or education. And you'll do this in a wide variety of settings, from government to international development agencies to community-based organizations and the academic sector. I'll just give some examples of where recent Mount Sinai master's graduates are now working: in healthcare consulting at KPMG, a leading accounting firm; in hospital administration at Mount Sinai's New York Ioneer Infirmary; in global health for the International Rescue Committee; in the Bureau of Disease Control at New York City's Department of Health and Mental Hygiene; as fellows at the Federal Centers for Disease Control; and in research at the Open Society Foundation, a philanthropic organization. The breadth of possibilities for meaningful careers as Mount Sinai graduates should excite and stimulate you. By choosing a health-related profession, you have the training and ability to do something valuable, something that truly matters to society. Your focus on prevention, population health, underserved communities, and health policy will affect not only individual patients and their families, but millions for whom health and well-being remain elusive. We may all work in different parts of the biomedical world and use our skills and talents to attack problems from very different perspectives. But one thing that we have in common is that we are all integral parts of the healthcare system. And unfortunately, as American broadcast journalist Walter Cronkite, most of you are probably too young to know who that is, once observed, and I quote, "America's healthcare system is neither healthy, caring, nor a system." And that was more than 25 years ago, and arguably healthcare has grown far more complex and difficult in the years since. So we have a lot of work to do. And while the continuing effort to prevent disease and improve healthcare access, quality, and disparities will not be easy, we are all extremely lucky to be part of this enterprise. Most people just have jobs. We're lucky because our jobs are also our hobbies. Our jobs are noble. They are, to a very real extent, for the greater good. I've always considered myself blessed because I love what I do. I look forward to going to work every day. I look forward to the next challenges. I anticipate what's coming along. And that's the advice that I'll leave with you today. The best gift that you can give yourselves and your families is to apply your new master's degree in your own unique way to something that you will find as rewarding. Thank you, and best of luck on your new adventures.